Hey guys, Joshua Austin here. In this video, I'm going to show you a restoration done using a new restorative material called ACTIVA Presto by Pulpdent. Presto is what's referred to as a dynamic restorative material. It uses ionic chemistry to promote a favorable environment inside the tooth for long-term health, particularly at the interface of the tooth and the material. It also has elevated handling properties, which include a really nice shapeability and stackability. It complements Pulpdent's already popular ACTIVA line of products. It's a great choice for primary pit and fissure decay, patients with high caries risk, or kids. Let's take a look. All right, so here's our pre-op situation here. We have some primary decay on tooth number 5 in the occlusal fissure system. So we're going to put a rubber dam on, and we're going to start prepping this lesion out with a high-speed handpiece and adequate water to keep the tooth cool. We're going to prep all the decay out here, and I like to use caries-detect or a caries-detecting dye to determine that. So we apply that caries-detect in and rinse it away, and that helps us determine the density of the tooth structure that's remaining. Obviously, if there's decay there, it's going to be less dense, so it will stain pink. If there's no decay there, it should all rinse away. So we're looking for a fairly clean area. There's a little bit more decay here, so we're going to go in and remove that. Here's our clean preparation after we've removed all the decay and everything looks clean. Now we're ready to start preparing the tooth to place our restoration. We're going to apply our phosphoric acid etch 37.5% to the tooth. I typically do a selective etch technique, and I use a universal bonding agent for most of my direct restorations. This keeps us from activating the MMPs that live in the dentin that can create some problems with us long-term with our dentin bond. So after about 10 seconds or so, I'm going to rinse that etch off of the enamel and then dry that tooth off. And now we're going to apply our universal adhesive to the cavity prep. I'm going to apply that universal adhesive. Make sure we have a good coating on everything, and then once that's coated well, we will then air dry and evaporate off the solvent that's left behind from placing here. So after we air dry the adhesive to remove any of that solvent, we're now going to light cure this for the appropriate amount of time, about 20 seconds or so. Mark. Okay, now that we're done with light curing, we're going to apply our restoration. In this particular case, we're using ACTIVA Presto from Pulpdent. Now, ACTIVA Presto from Pulpdent is a really cool material. It's biomimicking. It absorbs some ions from the oral environment and releases it back into the tooth. So it is a really great choice for primary pit and fissure decay. Now, it's not a bulk fill material, so you have to keep your increments to less than 2 millimeters or 2 millimeters or less. So I'll typically do a restoration like this in a couple different increments. It wasn't so much the depth of the restoration that I was worried about, but I was worried about basically the length of the preparation. I thought that would be too much restorative material to cure all at one time. So I did kind of the mesial half of that restoration first. Now we're going to go back and do the distal half after light curing. I'm going to go back and apply that. And one great thing about this ACTIVA Presto is that it's flowable and it handles really well. It has a little bit of stackability to it, so you can actually manipulate it, but it's pretty easy to manipulate into place, and it flows well as well. So it's a really easy material to work with and get really nice results with. So you can actually see I'm kind of shaping the ACTIVA Presto here, and it does that pretty well. And so once I know I have that where I want it, we're going to go ahead and light cure it. We're going to finally do our last little part here. And again, I break these up just to fight polymerization shrinkage. This material is not a bulk fill material, so we just need to be a little careful in the sizes of increments that we use, both in width, length, and depth. So once I get this where I want it, again, it shapes pretty well. And we're going to do our final light cure here in just a second. And then we'll be ready to look at the restoration as we're approaching its finishing. Now that the restoration's been placed, it's time for us to go in and take off the rubber dam that's been applied so that we can get a good finish and check the occlusion. Okay, now we're going to check the occlusion on our restoration here. And this is a pretty small primary decay and pit and fissure restoration, so I'm not expecting there to be a lot of occlusal function on this. I would treat Presto just like I would treat any other resin composite material, and I would finish it with a carbide burr, a 7404 carbide burr, and then adjust occlusion with that. And then you can go back and polish it with whatever composite polishing point that you like to use routinely. Any of those should work well for this type of situation. So here's our finished result with the ACTIVA Presto. This is a great use for this and small pit and fissure decay. But this also could be used for class 2s, for class 3s. It can be used in a lot of different clinical situations, and it works really well. You would use this as you would use any other direct composite restorative material. And I love using this in patients that maybe have high caries risks or have a high acidic diet, things like that may predispose them to decay, because I know that the biomimicking properties of ACTIVA Presto will help promote long-term stability of that restoration, reduce sensitivity, and hopefully diminished possibilities of having to do another restoration with recurrent decay for them in the future. So ACTIVA Presto is a great choice for those types of restorations. Thank you so much. You guys have a great day.